Cancer. Few other words have the power to leave people feeling so frightened and angry, but there is hope. With the recent opening of the Stronach Regional Cancer Center at Southlake, cancer patients in York Region and South Simcoe County can expect the most advanced care close to home. Joining us today is Dr. Woodrow Wells, a radiation oncologist, to explain how the Stronach Regional Cancer Center is supplying patients with a strong dose of hope. This is Daily Web TV. One of the most exciting things to happen in York Region in recent history is the opening of the new Stronach Regional Cancer Care Center. And speaking with me today about that center is Dr. Woody Wells. Dr. Woody Wells, so nice to have you here, and you are the radiation oncologist at the new program.
Yes, thank you for having me.
And I'm very curious as to what exactly is the cancer care program.
Well, it's going to be a pretty comprehensive array of facilities and programs for treating all kinds of cancer patients. Certainly we're going to treat all of the common cancers. We won't be treating a few of the uncommon tumors, but we're pretty comprehensive in terms of kinds of cancers people usually get.
So a cancer care program, does that mean that it entails everything from diagnostics right through to the treatment programs for support, mental, physical, all of those areas?
Absolutely. It covers the entire spectrum, even from prevention through to diagnosis, treatment, from chemotherapy and radiation therapy, and palliative care, end-of-life care if that's necessary. So we'll be there for the patient through the entire journey.
This is a new facility, which is very exciting for York Region. And I know you come from Princess Margaret, which is working with the new center, the new program.
Yes, it's a close partnership. That's how we're thinking of it. So it's going to be win-win for both institutions. So it's going to be also a win-win for the patients, I think, to be at the forefront of expertise in cancer care, but being delivered right here at home in Newmarket in our own backyard, as we like to say.
And this is something for regional residents that obviously has made a huge difference. So talk to me about that, and what are some of the advances in radiation as well?
Okay, so I think one of the biggest impact for patients in York Region will be the proximity of cancer treatment. Historically, we could see huge variations across the province in terms of how close a patient was to cancer treatment in utilizing this very effective treatment. So a lot of people just simply went without it and suffered at home or didn't get treatment. Absolutely. Wow. Because it was just too far to travel to a downtown teaching hospital to get the treatment, so they just put up with discomfort or put up with under-treatment and, had relapses. Right. So it's easy for patients. Right now, patients have a 1 hour at a minimum bus ride to the Princess Margaret to get their treatment from this building every day. And now it's going to happen right here. Amazing. So it's a huge burden lifted from patients and their families and support teams who had to do that commute. The other big advance in radiation oncology is the arrival of IGRT, image-guided radiotherapy, and also VMAT. Southlake will be the first center in Ontario opening with this new technology. VMAT is volumetric modulated arc therapy. So what that means in plain English is two things. The image guidance allows us to be vastly more precise in delivering radiation treatment, so more accurate, more cures, and the volumetric modulation simply means that we're able, again, to do two things. It makes the treatment much shorter for individual patients, so we can do now in 2 minutes what used to take 8 or 9 minutes. So that makes the treatment more accurate because it's simply easier for someone to hold still for a 2-minute treatment as opposed to 9 or 10 minutes. So that makes the accuracy go up. The other thing it'll do is allow us to treat more patients with any given treatment machine. So what used to be headline news in Ontario is long waiting lists to start treatment. Right. So now we have much, much shorter waiting lists. I can't promise there'll be none, but the problem will be much, much reduced from what we used to see.
Now, with these two advancements, obviously you're talking about accuracy, so that must translate then to the patient as less tissue damage as well, because you're really targeting the actual area.
Absolutely. The targeting is vastly more precise, and the radiation dose is sculpted around the tumor. And again, that allows two things to happen. Number one, we see much less side effect as the patient goes through treatment.
Right.
The other thing it does is it allows us to increase the radiation dose and increase the tumor control. So the balance of risk and benefit is now vastly in the patient's favor. Higher rates of tumor control, lower side effects, much easier treatments. We still see patients every week as they go through radiation treatment, and sometimes in the past those used to be very long conversations managing all those side effects, and nowadays patients say, got nothing to tell you, I have no problems, no side effects.
Wow, that's a big advancement.
Yes.
And both of these treatment programs will be standard in our cancer care program now?
They'll be standard at Stronach Regional Cancer Center. They are not standard even yet across the province.
Who will this radiation treatment be available to? Is it just people in the immediate vicinity of the Southlake Regional Health Center, or?
The catchment area, the population we're going to serve, is called a local integrated health network. So it's the Southlake York region, which includes Southlake as the lead hospital, but 6 other hospitals around the region. So that actually takes us north to Lake Simcoe and as far south as the 401 into the north end of Toronto. So it's really quite a wide catchment area of patients who will be coming here.
Excellent.
And we hope to make it a magnet institution as well, that people choose to come here just because it's a place of excellence.
And has an excellent team working with you in this new program, in this new center.
Yes, we are highly integrated and team-based because it does take a big organization and a large number of people, an array of professionals to bring this accuracy and precision to the treatment program.
And finally, can you just tell me a little bit about the actual building itself? Is everything under one roof? What can people expect if they have to come in for diagnostics and go right through to treatment?
So after diagnosis, it's one-stop shopping. The chemotherapy, the radiotherapy, and the aftercare will all be in one centralized place.
Dr. Wells, thank you so much for sharing this information with us today. It's an exciting new program for York Region residents.
Thank you for having me. It is exciting.
If you'd like more information about the new Stronach Regional Cancer Care Center, please go to southlakeregional.org. Keeping you informed, I'm Sheila Clark, and you've been watching Daily Web TV.